bioethical principles. When we talk about bioethical principles, we are talking here specifically about the principles regarding healthcare and in terms of considerations for mental health, specifically regarding the issue of civil commitment. So we can dive into some essential ethical terms that you are likely to encounter through your career and need to understand and be able to use when appropriate. The first one is veracity. This is all about truth telling. So we remember verity or truth in veracity, and that's your cue to always be honest with your patients. For example, the PMHNP provides a comprehensive risk-benefit analysis for medication management to ensure that the patient is informed before they consent to that treatment. Second, fidelity. So thinking of fidelity, we think of being faithful to the promises we've made. And an example of that in your professional career is your commitment to loyalty and maintaining trust with your patients, maintaining confidentiality, for example, within legal limitations. And third, we can consider autonomy. So auto means self, right? So autonomy means having control and making choices for oneself. This is something patients have the right to do. And an example of this self-rule sort of concept would be a patient seeking mental health treatment having the right to refuse the treatment recommendations that we make for them. So when we think about ethical terms, we also consider the idea of paternalism. So paternalism, this is tricky, right? Because this means that we are overriding a patient's decision, thinking that it's in their best interest to do that. You can think of a parent deciding what's best for a child in the case of maybe bringing them to the pediatrician's office and having them get their immunizations. The child doesn't want shots, but the parents decided that it's in their best interest to have those shots. That in general makes sense that a parent would have a right to decide for a child. But when we're talking about adults, we have some additional considerations. So though there are circumstances when we've decided as a society or as a profession that overriding patients' rights is justified, think of the example of involuntary commitment for a suicidal patient, we still work to avoid paternalism whenever possible. So an example of that would be the PMHNP engaging a patient in a shared decision-making kind of situation regarding their care, rather than, taking over and just telling them this is what we're going to do. So it's a balance, and there are different perspectives on what degree of autonomy versus paternalism is justifiable in different situations. That's why ethics is a gray area, and it is ethical concerns remain under discussion and up for debate. Another component or term is beneficence. So putting this simply, that means doing good. Beneficence is all about actions intended to benefit others, and think benefit, beneficence, benefit something good, right? Doing something good. For example, the PMHNP might offer treatment options with the patient's best interest in mind. They would offer treatment options with the patient's best interest in mind. Non-malfeasance, this is a cornerstone of care. Do no harm, right? We hear that a lot. And malfeasance is harm. So we are going for non-malfeasance, not doing harm or avoiding harm. For example, the PMHNP makes an effort to avoid re-triggering trauma symptoms in a patient with a history of abuse. Okay. Now we have justice. This ensures that everyone gets equal treatment and opportunity for care. And it's about fairness across the board, making sure no one is left behind or treated unfairly. And an example of this would be the PMHNP offering non-judgmental care regardless of age, gender, sexual orientation, race, religion, socioeconomic status, any other variety of circumstances that might otherwise um, cause people to discriminate. So these principles are pillars that hold up ethical practice, and they remind us to be fair, to do good, and to respect the rights of others. And depending on the circumstances, the ramifications of ethical violations can range from minor corrective actions to legal liability and even loss of licensure. Other considerations, we mentioned civil commitment, involuntary commitment, um, and this refers to the legal process where individuals are admitted to psychiatric treatment. This might be inpatient or outpatient, but in any case, the treatment they're being admitted to is against their wishes. This occurs for variety of reasons, and specific criteria must be met to pursue a civil commitment. Every state provides individuals with a hearing, the right to counsel, and periodic judicial review. And typically, proceedings might be indicated or initiated by a family member, mental health provider, law enforcement officer, or court official. And individuals facing commitment have the right to contest that commitment. The evaluation to determine if an individual meets criteria for commitment needs to occur within a certain number of hours or days after custody has commenced. And the most common hold time that we generally deal with is that of 72 hours. Varies state to state though. In the holding time frame, an individual should be offered treatment and the opportunity to accept voluntary admission if that's appropriate, or other community-based treatment. And independent providers are utilized to conduct the evaluation, in other words, to support or not support the need for this involuntary hold. The majority of states have standards for treatment and hospitalization. And civil commitment has been ethically critiqued, right? It's important to utilize ethical principles to guide decision making and ensure that commitment is beneficial and just. And again, there's can be debate. There will be debate over how that shakes out. But at the end of the day, you are working in the environment and the legal constraints that you find yourself in your state and organization, and you're documenting justification for your action, including paternalistic action if you have deemed that appropriate for the patient's well-being. Criteria for admission. So most basically mental illness, right? Criteria for admission, mental illness would be a criteria in every state, generally defined as serious mental illness that grossly impairs judgment, behavior, or the ability to navigate demands of life. Other criteria, danger to self or others. So this appears in the law in every state in various forms, but this is a criterion for admission if somebody's a danger to self or others. Grave disability. This also appears in the law for most states and generally is defined as an inability to care for self, provide basic personal needs for themselves, that sort of thing. Another criterion, need for treatment, required in nearly every state, the essential purpose of the commitment. What are we doing if we are taking someone's rights away technically and we are forcing to some degree some sort of treatment, then what is the purpose? What good may come out of that? Another criterion, deterioration. So not an exclusive criterion because we all ebb and flow. But if somebody appears in some state laws or as part of a definition of grave disability, the deterioration may be documented and explained as a reason for needing to move to a higher level of care to prevent further deterioration and perhaps to restore back to a higher level of functioning. incompetent to consent or refuse treatment. So this is another criterion potentially for admission. So that's described by various state laws as someone being unable to make rational or informed decisions, lacking insight, they're unable to evaluate risk benefit, and unable to express a voluntary informed choice. They might be deemed incompetent to consent or refuse treatment. Consent to or refuse treatment. And it's part of the law in a few states, but again, it's not an exclusive criterion, so it would have to be part of a bigger picture that explains why the risk outweighs the benefit of civilly committing the patient. In addition, most states require that commitments occur within the least restrictive means or environment by the least restrictive means for adequate treatment. So, for example, court-ordered medication, such as long-acting injectable antipsychotic medications, may be mandated in a community setting because they can be offered and support some stability, but they can be given in a community mental health clinic, for example. The patient doesn't need to be admitted for that sort of treatment. And criteria for release from the commitment. So treatment should focus on stabilization of illness, enhancement of independent functioning, and maintenance of controls that prevent patients from committing offenses to themselves or others, right? Patients are committed for a set number of days when they're committed, but they can be released or discharged before that set number of days if they're determined to be psychiatrically stable. A recommitment hearing must be held if stability remains in question by the end of the mandated period. So in other words, you can't just continue to hold the person. You need to reaffirm or express the concerns and then have that again legally supported in a judicial context. Provisional discharge, release to a court-ordered community-based treatment as a step down, for example, pending return to inpatient admission should the patient's condition deteriorate. Again, we're trying to do a step down, lower the level of care with the idea that if that doesn't work, then we will have to increase the level of care again. So readmission is a potential, but we're trying to move a patient out of the most restrictive environment as soon as possible. Okay, good job. See you soon.